want to thank all of you for taking time to join us today. I'm very excited to have you all here. For those of you that don't know me, especially in my incognito version, I'm Sandy Cowie. I am the president of the International Niemann-Pick Disease Alliance. I apologize, I am joining from work today, which is in the hospital, and therefore I'm required to wear a mask while I'm here. So you're having to put up with the slightly modified visual of Sandy. It's my great pleasure to have you all here today to share a really exciting piece of work that the INPDA, NNPDF, NPUK, and the International Niemann-Pick Disease Registry have been working together on with regards to patient-reported outcomes and the pediatric experience with olipudase alfa. As you all know, there's tons of challenges in the drug development and regulatory space for small rare diseases such as ASMD. And this has been a global and collaborative approach to evidence collection and ensuring that there's accessibility of that evidence to support research, HTA assessments, and reimbursement. This work demonstrates the value of patient organizations and the registry in that we were able to identify a project need, get the work undertaken collaboratively, professionally, and quickly, and are able to now share the outcomes of that work with all of you. There is a huge value to the ASMD community in terms of the information we're able to gain from work such as this. It helps us build on our knowledge base of ASMD and its implications for patients, families, and our community as a whole. It helps us build on the data that we're already working on building within the International Niemann-Pick Disease Registry and the patient-reported data set within the registry, and helps us work as we move forward with regulators, funders, and other authorities when we look at next steps moving forward with treatments. Patient organizations are experts in rare diseases with our patient communities, and we need to ensure that we're involved in all points as we move through the regulatory and drug development processes. And this is one of our strategies for being able to do that. I have the great pleasure today of having both Justin Hopkin, who is the chair of the National Niemann-Pick Disease Foundation, and Conan Donnelly. Oh, Conan, I've changed your last name to Donnelly, who is the Chief Executive Officer of the International Niemann-Pick Disease Registry. Many of you will be familiar with both of them, and they are have lent a ton of expertise to this project and have some great information to share with you all with regards to this project. We have a slide deck that they're going to share with you. A couple of points for you, because this is in a webinar format, you won't be able to speak to encourage questions. So you will find at the top of your screen or the bottom of your screen, depending on which device you're using, a Q&A box and a chat box. You can use either of those functions to put in questions for Justin or for Conan. And at the end of the session, we will do our very best to get all of those questions answered. If there is something in the questions that either needs more info than we currently have available to us, or just needs some more research so that we can get the right info back to you, we will absolutely endeavor to make sure that we get those answers to you, even if we can't get them done today. So please do enter your questions. We will absolutely get to them. Very much want this to be something that is of use and value to you. So if there's things that, don't make sense, that you need more information on, or you just want to understand better, let us know. And with that, I'm going to hand off to Justin.
Thank you, Sandy. It's great to see you. Thank you for taking time out of your busy workday, and appreciate your leadership. And I think all the member organizations that are listed here. I think this is, as you said, a great example of a collaborative global effort to really hopefully provide a lot of value to our community in all the ways you described. So I'm going to get started. The talk today, we're going to review clinical outcomes. Shrink a window in ASMD in patients specifically taking olipudase alfa, and will be a review of published data that will be brief. And then we're going to highlight the importance of the patient voice and patient-reported outcomes and review both qualitative and quantitative data from pediatric patients and families currently involved with taking olipudase alfa. So we have both numbers and data that you'll be seeing on the screen, but also direct quotes from the patient experience that we were fortunate to obtain as part of this study. So the first large study that was published approximately a year and a half ago was the Pediatric Ascent trial, the one-year results of a clinical trial on olipudase alpha enzyme replacement therapy. And what this trial did is screened patients from all over the world. There were multiple sites on multiple continents to fill 20 patient slots to enroll in a non-placebo controlled trial. So there was no placebo arm in the pediatric study, and they enrolled 4 patients in the adolescent arm, 9 patients in the child arm, and then 7 patients in the infant and early child arm. And in that study, these are the main table that came out of that trial, and I don't expect you to be able to read this, but I'll try and guide you through it. Up here in the left-hand corner, we looked at the spleen volume of these patients. Down at the bottom of the graph is normal spleen volume, and with increasing size on the x-axis, we have a larger spleen. And across time, what we saw is the spleen decreased in size really in all the patients that were involved in the study out to 52 weeks or 1 year. And this bar graph shows that it occurred in adolescents, children, and early infants. So overall, everyone saw a reduction in spleen size. We see a nearly identical or very similar graph in liver size. So again, normal liver size being down here. We started a baseline where the liver size was enlarged, and we saw it shrink across all 3 different age groups that were studied. And then we looked at lung function test, and they did that with something called a predicted DLCO, looking at how a compound can diffuse across the lung. And as that number goes up, that means that the lung is more healthy and functioning at a higher level. The top of this graph means no impairment at all, and the bottom is significant impairment. And we started at a baseline here. As you can see, most of the patients studied tended to trend or all trended in the positive direction and remained flat with no reduction in lung function. And we see that that proved true for all 3 age groups. And these last graphs were markers of liver inflammation with tests known as liver function tests. Again, starting at baseline at time 0 and going out at 52 weeks, we saw those tests decrease across all 3 age groups in both ALT and AST, suggesting that liver inflammation and size were diminished in the study. All positive results and all primary endpoints in the study. The other thing that they looked at in the study was total cholesterol. So most cholesterol measures you want to go down to improve a lipid panel and to decrease bad cholesterol. And we saw that in the boxes on the top left, in the middle here, and on the right. This box that trends up is your good cholesterol. We'd like to see that number higher for a good healthy lipid profile, and it did go up over time. And again, this was consistent across all 3 age groups studied. And then the last piece of data that came that I'll present today out of that study was the height. We saw that the height was lower than baseline expected for age in the participants. So here is a normal height based on the age that we would expect for the participants. They were all low. And over that 52 weeks, they all moved up, suggesting that their height was improving at a rate more rapid than what we would expect with just normal growth. So all those things are very positive that we saw that were measured as part of the Ascend pediatric trial. We then had the published results of a randomized placebo-controlled adult trial that were 1-year results. And they looked at very much similar things, but in this study, we had a placebo arm. And at the top, we're going to look at that lung function test, or the DLCO. And what we saw in the placebo group, who is, I'll call it a reddish purple color here, there wasn't a lot of change in DLCO in the placebo group, but we did see a % from baseline improvement at both 26 weeks and 52 weeks with the patients who received olipudase alpha. So similar to the pediatric study, we saw improvement in that measure. And this is another way to look at that same data over this period of time. We're looking at the predicted DLCO. As you can see, it remained relatively flat appearing in the patients receiving placebo on this side, but in those that received olipudase alpha, we saw a general trend in the positive direction. They also looked at CT scans to see if they could see markers that would suggest accumulation of lipid within the lung on patients at baseline, and then looked at that over time. Normal lung on CT scan looks black, like the top of these lungs here. An abnormal lung that may be filled with lipid or other material within the lung looks white, like we're seeing down here. And what we saw in the placebo group is that this line remained relatively flat to increasing, and that in the olipudase, we saw that the CT scan scores looked like that they had improved and had less of that ground glass opacification, which would be suggestive of potentially clearing of the lipid in the lungs. And the predicted forced vital capacity is another lung function measure, and that improved in those patients that were studied as well. They also looked at spleen volume. And spleen volume very much improved, and the spleen shrunk in the patients receiving olipudase with these percentages over here. So we saw a 30% decrease in size from baseline at 26 weeks, and at a year we saw a greater than 35% decrease compared to the placebo group, which was relatively flat. And we see that highlighted here, where the placebo group is relatively flat, but we're starting with an enlarged spleen and then trending down to a mild or moderately enlarged spleen at 1 year. We saw platelet counts, which are blood clotting cells, increase in the olipudase group while they stayed relatively flat at a year. This could be from bone marrow production, but also decreasing the size of the spleen, where platelets tend to live, can also be helpful for this. And this splenomegaly scale was an attempt to look at impact on the quality of life of patients. As you can see, the placebo arm and the intervention arm remained relatively similar in this group, but later the authors commented that they weren't sure that this was a tool that had been validated in this patient population and probably wasn't appropriate for patients with ASMD. And then the last study is looking at the liver. It looks very similar to the spleen. We see big green bars where there's a large reduction in spleen volume, up to almost 30% at a year, where in the placebo group, we didn't see much of a change. Liver biopsies were done in these patients, and they looked for sphingomyelin, and they saw a reduction in sphingomyelin on those liver biopsies in the patients receiving olipudase. They did not see a change in sphingomyelin on those liver biopsies in those patients who did not. And then looking at those same measures of inflammation in the liver, the ALT decreased by 40% from baseline, suggesting decreased liver inflammation in patients who received olipudase. And in the placebo, they didn't see much of a change at 52 weeks. The bad cholesterol decreased, and the good cholesterol increased in patients on olipudase, where those measures remained flat in the placebo group. So what we can say is that both studies achieved their primary endpoints of decreasing spleen size, decreasing liver size, improving lung function tests, and other markers, including changes in height on those primary endpoints. So now I'm going to turn it over to Conan to talk a little bit about, with those great trial results, why we would go about trying to understand the patient voice and how it played into the work that we've done.
Thank you very much, Justin, and I would just echo your comments earlier and Sandy's. It's been terrific to work on a collaboration like this, and it's much needed to bring different groups in the community together to undertake work like this so we can really understand the patient experience. We were asking the question, what can together can we do to amplify the patient voice in relation to experience with olipudase alpha? And you know, we want to understand the burden of disease, the burden of therapy, the benefits of therapy, risks and tolerance of risk, so to inform those who make decisions around therapy. And while we're very fortunate to have multiple publications that outline the experience of the disease, our community does lack data on the impact reported by patients. Next slide, Justin. So this collaboration between the registry, the NNPDF, NPUK, and the INPDA We looked at utilizing the strengths of these partner organizations and engaging with a third-party research organization, this rare disease research partners based in the UK, so as to bring a level of independence and a level of scientific rigor, so we can and explore the impact of olipudase alpha on pediatric patients and their families. And the aims of this work were to increase understanding of the impact of ASMD on patients and their families, to explore the effect of olipudase alpha on pediatric patients and families, and to gain insights from patients and families into the unmet need and with regard to treatment of ASMD. And our methodology, it was a mixed methodology, which involved an international online survey in the English language, followed by semi-structured interviews. The survey was open to adults aged 18 and over, or their parents and caregivers who were fluent in English and able to give informed consent, and had confirmed diagnosis of ASMD and had used the experimental drug olipudase alpha for more than 12 months and had commenced treatment with olipudase alpha under the age of 18 years. So the survey was undertaken in the Qualtrics platform, and it was distributed via a link, and it was open from the 19th of January to 15th of February 2022, and it covered demographics for symptoms, treatment with olipudase alpha, symptoms before and after treatment, overall change in symptoms and activities since treatment, and current treatment for ASMD, along with experience with olipudase alpha and satisfaction with the therapy. It was a mixture of multiple choice, matrix, and open text questions. And the survey was designed in collaboration with rare disease research partners and with input from the collaborators. The interviews were to supplement the questionnaires and involved a semi-structured interview guide with a semi-structured format that was based on the questions from the survey to allow us to understand in more depth the responses from the participants and the impact of the therapy on patients and families. They were conducted by Zoom by a third party called Connect Research, with an individual researcher responsible for all surveys, ensuring a consistent approach. 10 interviews took place between the 4th of February 2022 and the 21st of February 2022, and these were audio recorded and transcribed for analysis. Both the qualitative and quantitative data were analysed by rare disease research partners, and the transcripts were analysed using in vivo, and a thematic approach was applied. Thank you. So we started off with 26 records, and of which 25 consented to participate in the survey, with 2 excluded due to no confirmed diagnosis by a doctor, and 2 further excluded who had not received olipudase alpha, and a further 5 as they hadn't been receiving the therapy for more than 12 months. 4 didn't complete the survey, and there were 2 non-pediatric patients that were also excluded. So we finished up with 10 survey participants, and a further of which 8 participated in the interview. And these were based 7 in the United States, 1 in the United Kingdom, 1 in Belgium, and 1 in Brazil. So we'll pass back over to you, Justin. Thank you very much.
Great. Thanks, Conan. And it's now my pleasure to review the data that we were able to obtain from those 10 patients. And we started all the way back at the beginning of diagnosis. And none of the patients who were studied in this survey had the diagnosis made before birth. On average, the median age which diagnosis was made was 1. One patient was tested for ASMD because of a confirmed diagnosis in a sibling, and that was the only person who had the diagnosis made before the age of 1. We did ask when symptoms first started to appear, and 4 of the 10 said that they were diagnosed before symptoms appeared, while the other 6 said the diagnosis was made after symptoms appeared. in asking about those first symptoms, they were often reported at different times, some between even less than 2 months of age, which is what one person said. 6 noted that between 2 months and 2 years are when symptoms of ASMD first were noticed. And then another 3 said it was after 2 years, between 2 and 6 years, when symptoms occurred. There were no patients who noticed first symptoms after the age of 6. And now we're getting to the qualitative part of the study. And so intermittently, I'll be putting in quotations from the study. And we're very fortunate that those that took part in the study agreed to have this information shared. And in talking about the Diagnostic Odyssey, one patient said, we finally got frustrated with the pediatrician and saw another pediatrician who immediately saw her belly stood out to him. And he said that wasn't normal. Another said there were all sorts of red flags popping up here, but the doctors kept telling us she was fine. After many tests, one person actually sort of made the diagnosis on their own with a Google search. They had been searching for a diagnosis for 6 months, routine tests, they took blood, and they couldn't figure out what was wrong. And this parent did their own research and came across Niemann-Pick disease, requested that that be tested for, and that's how the diagnosis was made. And for another child, it was relatively quick. It was just a month, a relatively quick diagnostic journey. A CT scan showed the spleen and liver involvement. The initial testing came back looking, it was negative for Gaucher disease, which can be very similar to Niemann-Pick in appearance. And the next panel, the metabolic disorder, doctor sent off, Niemann-Pick was identified. We asked in the interview and in the survey about patients reporting neurologic symptoms, and patients were able to report more than one neurologic symptom. So in this study, 6 of the 10 reported no neurologic symptoms, 3 reported ataxia, 4 reported hypotonia, 1 reported neuropathy, and 1 reported seizure. And again, you can report more than one, but based on this, with 6 reporting no neurologic symptoms, that would translate into 4 that reported at least some form of neurologic symptom. We asked when olipudase was started and how long patients had been on it. And the median was at 5 years. Some started as early as 1.5 years in the study, and those that were surveyed started as late as 14. And thinking that we're looking at the pediatric population and those age breakdowns of the Ascent Pediatrics trial, that range fits. All patients were still on olipudase at the time of the survey. So these patients had a very robust experience with olipudase, and a mean of 4.6 years. Ranging from 1.3 years up to 6.1 years. And again, all patients still remained on drug at the time of the survey and the questionnaire. We wanted to gain an understanding, while we had some data on improvements in spleen and liver and height, how did that translate into the patient experience? And so we looked and spoke with leaders in the field. We referenced natural history studies, and we tried to identify what symptoms would be most commonly associated with ASMD. And then we tried to ask about those patients as part of the survey. And in the survey, bone pain was noted in 3 out of 10 patients. Some noticed it weekly, 1 noticed it weekly, and 2 noticed it monthly before the study started. And at the time that the survey was done, there were no patients that reported any bone pain. Abdominal pain is commonly quoted in the literature, and when we think about spleen and liver involvement, that is a common connection that we can draw. And 70% of the patients reported abdominal pain, some reporting it all the time or daily in 30% of patients, 20% reporting weekly, and 20% reporting monthly before the survey started, or before olipudase was started. At the conclusion of their time on olipudase, or when this was obtained, a full 80% had no abdominal pain, which is just remarkable. 1 patient said they still had abdominal pain weekly, and 1 patient said, I still have abdominal pain daily. And in the comments about abdominal pain, there was one family that said she complained about pain in the belly. So it's very difficult for us to exactly understand what it is that she feels. But I remember that every day she said, yes, my belly hurts, I have pain. Maybe it was the organs that were very dense, I don't know. It was difficult for her to exactly indicate where it was, but every day she told us that she was having pain in the belly. And then at the time of the study, after being on olipudase, the pain in the belly is completely gone. I think it's due to the organs that went to normal size. And that is also supported by what the doctors tell us. And that's somebody who was diagnosed at the age of 2, started on treatment at 4, and has 3 years on olipudase therapy. Oh, I jumped in my slide deck. I'm going to go back up here a little bit. We're a little out of order. I apologize. In looking at hepatosplenomegaly, we had all the patients noted that the organs were very enlarged before treatment started. So that's enlargement of the liver and the spleen. And then at the time they were interviewed, 80% said that the liver and spleen were not enlarged at all. And then 2 of the patients thought that the liver and spleen were somewhat enlarged, which is a tremendous improvement. We were noticing that she was having a very challenging time eating. She would say, I'm hungry, I'm hungry, I'm hungry. Then we'd feed her. She'd take one bite and say, I'm full, and get up and walk away from the table before starting therapy. Another said, but his organs, his belly was becoming increasingly more distended before ERT. He was hooked up to feeding pumps because the pressure that was being put on his stomach, he was only able to tolerate small volumes at a time. He was on continuous feed, so he had a feeding pump hooked up to him all the time and oxygen hooked up. It's just a lot of stuff for a little kid to deal with. Absolutely. And then another comment. She fell a lot. So due to the bigger belly, she had some stability problems, and she really fell a lot. The only times when she missed school was when she fell. That happened 1 or 2 times or something. Yes, she got an impact, a trauma on the head, but after treatment, the belly was completely gone. So really remarkable changes in the size of the liver and the spleen that people saw. Another common symptom reported in the literature was nausea and vomiting. And as you can see, it was not reported in 4 of the 10 patients, but in 6 of the 10 patients, it was frequent. Some saying one saying all the time, and another 2 saying daily. But after experience with olipudase, 80% reported that they no longer had any issues with nausea and vomiting. 1 reported daily still, and another reported monthly. One interview participant said that, so when he was first born, he was pretty typical developing baby. He did have a lot of vomiting issue, which we had been told numerous times that it was just reflux, but we felt like this seems a little more severe than reflux. But we were first-time parents, so we didn't really know. So the vomiting got progressively worse before he started on olipudase. There were days he would vomit upwards of 5 times a day. Then after treatment, he went from throwing up 5 times a day to now maybe vomiting once every 4 or 5 days. So he still has occasional vomiting, but it's immensely better than what it was. And now it's manageable. Another comment, he would eat a full meal and he would eat a lot. Then he was finishing eating, he would throw up, which it makes sense now, and everything being so enlarged. But yes, so he would eat, and that's why I didn't understand why he wasn't gaining weight. Because he would eat a lot and then he would throw up, not at the end of every meal, but enough to make you wonder, why is this happening? Another quote, it would be every 3rd or 4th day he could have a vomiting episode. It seemed like he would get backed up or take too big of a bite. Something would cause the gag reflex in him. He didn't have any problems swallowing, but 90% of his calories came from Pediatric, a very thick liquid that he drank, with a little bite of food on the side of that. And then after therapy, about 6 months into treatment, we started watching him wolf down food, and we were just ready for him to gag because then all of a sudden he just taking orange slices like nothing. And then I think I just remember looking up at each other like, holy cow, he's just downing food. And so all of a sudden he could eat no problem, everything and anything. We slowly phased out the fortified drink. It was probably decrease. It took over a year. And another comment, he's still a very happy boy, but no child wants to be throwing up 5 times a day. And he'd wake up first thing in the morning throwing up, and it was just uncomfortable for him to sit for really short periods of time. You could just tell it was uncomfortable in his belly. So it affected really all areas of his development. So the next question that was asked as part of the survey is the overall change in abdominal problems is sort of a group since starting treatment with olipudase alfa. And the participants could choose from any of these 7 points on the scale, and every participant said the abdominal problems were very much better from before starting therapy to where they were at the time of the survey. We looked at lung function as part of the outcome in the pediatric and adult trial. We wondered how that translated to shortness of breath and how patients felt that it may have impacted them. 40% of the participants in this survey said that shortness of breath was something that they experienced, some daily, some monthly, and that improved to just one person experiencing shortness of breath monthly after experience with olipudase alfa. And the comment that we noted was that it was her favorite thing to do is to play tag. And when she'd run and she'd be holding her stomach to get away, she'd get to the safe spot and you could see she was always out of breath. Bleeding and bruising is also something that is noted in the literature, probably multifactorial based on the science, but we wondered what the patient experience was like. And so we asked who had nosebleeds before starting olipudase, and was that any better? And 2 of the 10 participants noted nosebleeds, 1 daily and 1 monthly before starting olipudase, and that improved to just 1 patient noticing monthly nosebleeds with their experience with olipudase. But we asked also about bruising. And bruising, 50% of participants noted that that was a problem between all the time to weekly. And that improved to just 2 of the participants noting monthly issues with bruising after their experience with olipudase. And the quote that we received was that it was really hard to stop his bleeding. He didn't have nosebleeds, but if he got a cut or a scrape, you could see the effect of the disease on his spleen. Like, that part was hard. It was very hard to get his bleeding to stop, although he never really had nosebleeds, which was interesting with him. Fatigue is also something that's been widely reported by patients with ASMD in the literature. And we asked about fatigue, and of those 10 patients before they started on olipudase, they all reported fatigue. The frequency was between always, often, and sometimes. After the experience with olipudase, 20% said fatigue was never a problem, and 50% said fatigue was rarely a problem. So you've moved 70% of the patients, or 7 of the 10, into the rarely or no fatigue being an issue, with 20% saying often and 10% saying sometimes, which is just a remarkable change. One patient family noted, yes, often tired, didn't want to do anything before treatment. After treatment, he's able to be active. He's doing push-ups. Another said before treatment, when she was really young, she never wanted to sleep. She was always very happy and very joyful. And as time passed, we noticed that her energy level decreased. And when she got from school, she asked us to go to bed. We also noticed that if she had to walk a certain distance, that it was difficult for her to catch up with the other children because she was always tired. But after therapy, the energy, she is really full of energy now. It's amazing. She's very active and she likes to do sports. Now she's really an early bird. She wakes up very early, and it's not a problem for her to handle these long school days anymore. Great success. We looked at the growth curves as part of the pediatric trial, noting that short stature is a part of ASMD that has been widely described. And we asked the parents, as far as growth delay, would you rank it as not at all, somewhat, or very much before you started olipudase therapy? And 7 of the 10 said very much. 3 of the 10 said somewhat, and no one said not at all. After the experience with olipudase, how would you evaluate that change in growth delay? And 8 out of 10 thought it was much better, and 2 of the 10 thought it was somewhat better. So all saw a positive impact in growth, and that change had been a significant improvement with olipudase. Several comments on this that we thought were very impactful. You wouldn't think it. If you saw her today, you would not think that the child could not walk, that she was a bag of bones, that she was 9 months old and in 3-month-old clothes because she was so small. You wouldn't think it. Another quote, before beginning the drug, He was, I think, in the 15th percentile for his age of height and weight. And now I believe he's in the 85th. I think it's the 85th percentile, but he's got a head full of hair. He's over 3 feet tall. He's weighing about 40 pounds. He's a little skinny, but he's tall. Another quote, he has grown a ton. He went from not being on the growth chart at all to now he's at the 50th percentile for weight and height. So he grew a lot, put on a lot of weight, and he's a healthy size now. His body is just absorbing nutrients a lot better now. Another quote, he was always on the 3% growth curve, and he's up to the 30th, 40th percent growth curve now. So he's still, I would say, small, but he's not the tallest in his grade, but he's not the shortest. So he's grown quite a bit, and we've seen a huge impact on growth. But we've had the impression that before she was really small, and it was also confirmed when they measured her that she is somewhat small. But now if you compare her to other people from her school of the same age, it's rather normal now. So impacts across multiple patient families on a very profound change in growth. I think one that patients and families and clinicians don't often think about is infections associated with ASMD. And 90% noted at least one infection over the previous 6 months, and 60% noted more than 3 or 3 to 4. After the experience with the olipudase, and we asked patients during the time period we surveyed, how many infections have you had in the last 6 months? And 90% said none, with just one patient noting 1 to 2 infections. So that's really a tremendous change in infections. The number of ear infections were dramatically reduced in a number of patients. One comment, he would constantly have ear infections. He had 2 sets of tubes in his ears before treatment. But after treatment, he had not had an ear infection in probably at least 2 years. It's been a long time. Some parents and caregivers explained that before treatment, infections like colds would result in a hospital stay, but that changed significantly after receiving treatment. And the quote is, whenever he got sick before enzyme replacement therapy, he would 9 times out of 10 end up in the hospital, even if it was a common cold, just because his lungs weren't in the greatest shape. Actually, the first time he got a cold after being on the infusions was the only time he didn't end up in the hospital. Other comments about infection. She would get ear infections a lot, and they would give her a 10-day supply of medication, and it would never heal. She would have to go through 2 10-day cycles, but it was on a monthly basis, and she was getting ear infections. Another quote, yes, she had 4 over 6 months, got a lot of ear infections. It was so bad to the point where we got tubes put in his ears at a young age, just because that's how bad it was. It was constant ear infections. It was constantly colds, everything, and a fever always comes along with it. So it was tough. Another quote, so for his first year, we noticed that this person developed RSV when he was a few months old. He always seemed congested, but we were always met with it's allergies. But he's so young, you really can't diagnose a child with allergies this young. So we just noticed he always had some type of respiratory something going on that just never seemed, it would just never clear up, and then it would come back. Another quote, he had to be on CPAP briefly with some oxygen. And what started that was a bad virus, and we had to cure him of that virus. And then he got his tonsils and adenoids out. And then the other infections. So it was just basically the one hospitalization came from the flu that turned into pneumonia. And then he was on BiPAP for a while. And then the other infections might have just been a regular cold. So one very important thing is trying to improve patients' health to where they can do normal activities, including school attendance. And at the time of this survey, 8 of the 10 participants attended mainstream school, and one of the participants was attending further education in college or university, which is great. The comment we received before the treatment, she was always very tired when she came home from school. And that is not the case anymore. In the morning, she had difficulties getting up, and she was still very tired, and it was a struggle to get her to school. Then we walked to school. It was really a struggle, and that is not the case anymore. Now she's really an early bird. She wakes very early, and it's not a problem for her to handle these long school days anymore. She's really full of energy now. It's amazing. She's very active, and she likes to do sports. For sports, coming off that theme, we ask the parents and caregivers if experience with olipudase affected participation in sports, and 8 of the 10 said that their children had an increased ability to participate in physical activities, where 2 of the 10 said that there was no change. some fantastic quotes on this topic. We did let her participate in everything she wanted to participate in, except for gymnastics, which we deemed to be a little bit too dangerous, especially if she landed on her stomach. She couldn't do a cartwheel. Her body was just not normal. Her cartwheel, she would just plop on the ground because her stomach was sticking out. Not being able to do what she really wanted to do, which was gymnastics, I think was really tough on her. After treatment, so it must have been about 6 months after she started treatment, we allowed her to do gymnastics, and she literally went from not being able to do a cartwheel to being a state champion. So now she's a competitive gymnast. So she's completely done a 180, 360, whatever you want to call it. Everything is completely changed. I never, ever worry about her health anymore. And another comment. He got the okay to start participating in contact sports a couple of years ago. Now he plays, he's on a travel soccer team where he plays year round. No issues running, he plays midfield, and he's up and back all game long. So running is not an issue. He actually does kickboxing. The doctor gave him the okay to ride a bike. So he's been riding a bike for a couple of years. I just think it's amazing. Kickboxing, soccer, gymnastics, riding bikes, these are all things that I think would have been taboo for most, if not all, ASMD patients. There's a tremendous impact on mental health that we understood from previous literature that's come out looking at patients with ASMD and the caregivers' responses to that. We wanted to delve into that a little bit more in this study. 60% of parents reported that ASMD impacted their child's mental health for a variety of reasons, including being bullied for being short, being bullied for having a big belly, poor self-image, feelings of isolation, anxiety, depression, and guilt. So our follow-up to that was, well, what changes did you notice before and after starting olipudase? And they felt that the bullying was better, a better self-image and confidence helped, and that parents felt better knowing that the child is physically more comfortable and they didn't have limitations like they did before. There were some questions around having feelings of isolation. Many reported that that was gone, but some still reported there was some feeling of isolation. Some noted that the clinical trial participation still was a barrier to that. For some, there are less feelings of anxiety and depression. Others are still suffering from anxiety, depression, and having to miss school for treatment, having to explain why they were different was quoted. And others noted anxiety about being sick and dying and feelings of guilt associated with this chronic condition. Observations from this. I felt like with him being in the trial and his liver and spleen being normal sizes, when you would help him walk around, he's happy because he knows he can do it. The drug has drastically improved our son's life. He looks and acts like any other kid his age. He is much more confident now that his belly is small and that he is similar in size to his peers. You would never know that he has ASMD. People just come to her. She attracts friends, so many friends, more friends than I ever had in my entire life. People just are attracted to her. She's the center of attention now. That definitely would not have happened if she hadn't received the treatment. And the last quote, he was happier. He was able to do things that other kids were doing. He has a friend in the neighborhood that would come over and always ask, what do you want to do? Go on a bike ride? So he's able to do those things, which he wouldn't have been able to do. Very meaningful changes to families and to patients. And we also asked not only about the impact of ASMD on the patients, but to the caregivers themselves. What impact has ASMD had on you? You could answer or acknowledge more than one. And this was before treatment with, or before therapy with olipudase had started. One person said that it really had no impact. 2 noted physical impacts. 9 of the 10 noted mental health impacts. 3 noted impacts on family and social life, 3 on relationships, 1 on independence, and then another. One of the many powerful quotes that we received on this topic, I think you think of them every day and you think of them every night. You wake up thinking about it. That takes over your life. How am I going to normalize my child's life? How is she going to be able to live normal and not be constantly sick and in the hospital? The next quote. Rowdy thought that he was on borrowed time, but I think there was an emotional exhaustion that you don't even notice. You're just kind of waiting for the ball to drop, sort of like the whole time. You're just waiting for him to lose an ability. You're always looking for the regression. The next quote, I can't even tell you how mentally exhausting it is to clean up vomit so many times a day. It just wears on you, not even physically, but emotionally. It's really hard to just watch your child constantly throwing up and just looking like they're feeling awful. Another quote, really trying to learn how to cope and still be a parent to another child that doesn't have a medical diagnosis is a whole nother chapter in our lives that we had to learn how to do. So the follow-up question was, what impact has olipudase had on the caregiver's health? And we wanted to know what's improved since treatment started. One person said nothing's really improved. No one noted that their physical health had improved, but 8 noticed an improvement in mental health since starting on olipudase alfa. 4 noticed an improvement in family social life. 2 noticed improvement in relationships. 1 noticed an improvement in dependence, and 1 noticed another improvement that was not asked about. The quotes that we saw here, we kind of breathed again. Before, you just felt like felt like there was no sleep, so fearful to look forward to the future. Now it's hard to describe without getting emotional. Everything has changed. It's completely changed. We're able to breathe again. We're able to have hope again, and we love sharing about it. Our anxiety level has reduced tremendously. Our depression has lifted. Another quote, after the child started treatment with olipudase alfa, my stress level went way down. I no longer felt like he was running out of time, and it was amazing to watch him grow, eat, and gain strength. So we asked caregivers about their concerns about their child's future before they were on olipudase. And then we asked what change olipudase had on those things. And so before starting olipudase, there was no one that had no concerns. 4 of the 10 noted a concern about their child not being able to find a life partner. 9 of the 10 noted fear of losing physical abilities. 6 of the 10 noted a fear of increasing social isolation. And everyone noted uncertainty about the future in general. So we said, how did those things change? And in the graph on the right, if the pink that is seen on the far right says that things are much better, and the green says somewhat better. So I'm going to group those together into either much better or somewhat better. 75% noted that not finding a life partner was better, or 3 of those 4 after starting olipudase. In the fear of losing physical abilities, almost 80% improvement, either somewhat better or much better. A fear of being increasingly socially isolated, 83% much better. Uncertainty of the future in general, 60% of people said that was much better, and 30% said that was somewhat better. And so we saw dramatic improvements about forward thinking and concerns that parents have about their children. We then tried to focus on the impact on the mental health of caregivers. One noted we had such negative thoughts about his future early on that right now, if you can tell us this is the best it's going to get, that's incredible. We're thrilled because he's able to live a normal life and there's no concerns. I have it all about that. Another quote, it's been life-changing for us as parents, just to know that his organs are normal sized and just to know that he's not in pain and discomfort all the time. It's everything to us. And getting him off oxygen and just having him feel more like a normal child, not being hooked up to things all the time. It's a really big deal for us and for him, where it's been a lot easier to go places now because we're not constantly having anxiety about him throwing up in the car or when we get there. We're not having to pack 5 changes of clothes to leave the house. So it's gotten drastically better. And that's for someone who started treatment at the age of 2 and has 1 year and 3 months of experience on olipudase. So in thinking about the neurologic aspects of ASMD, and with 4 of the 10 reporting that they may have had neurologic symptoms at the start of the study, we did want to ask about cognition as what we thought would be a key factor in neurologic aspect of ASMD. And so at baseline, we said, Were cognitive abilities affected by ASMD? And one person said that they were very much affected by ASMD. One person said they were somewhat affected. 2 people said a little bit, and then 6 of the 10 said that the cognitive abilities were not affected at all. So you have 4 people that noted at least some impact on cognition. And then after lipidase therapy, did that change? And no one said it was much worse. 3 of the 10 said it was somewhat worse. 5 of the 10 said it was about the same. 1 said it was somewhat better, and 1 said much better. And so in thinking that olipudase is not thought to cross the blood-brain barrier, and seeing 30% say that it was somewhat worse in people noting neurologic disease, you can draw conclusions about that, but that's why we asked the question. We were glad to gain some insight on that question that we had. And so then we asked about unmet need, and where caregivers saw if there was additional therapy that was still needed. And 5 of the 10 said there was still a great need for additional therapies. 1 of the 10 said that we have a lot of need for additional therapies. 2 said there was a moderate need. 1 said there was just a little need, and 1 said there's really no additional need at all for additional therapies in ASMD. And the comments around unmet need, this drug has saved my son's life, no doubt about that. We are so grateful and always will be, but it doesn't cross the blood-brain barrier to aid in neurologic involvement. Other comments? Well, I feel like you couldn't just jump in and save the brain in any other way. You would have to treat them with this drug first anyway, before you went on to another one. If there was a way for this drug to hit the brain, it would be great. And there's just going to be another need, not a replacement, but just more. And the last quote, I feel like this treatment is working beautifully at reversing damage done to their bodies and basically making their bodies normal again. But now the second piece of the puzzle is finding treatment to slow down or stop the neurologic disease progression or even reverse it. And it's so important. We asked about participation in the clinical trial, as several of the participants brought it up. The hardest part of everything is the strict rules of the trial. The trial itself was the harder part than the drug itself. That is what caused the majority of the stress, getting the MRIs, getting the ultrasounds, and even something as little as them being done with their infusion and then having to wait an hour to get their vitals done. That hour of time frame, that's always been the hardest thing out of there, because the kids are done. They want to be up and go around. It's just that extra hour after 4.5-hour infusion that adds to the point. Another comment. For the past 1.5 or 2 years, we've been getting in-home treatments. And the nurses are able to come in the house and give them their infusions here at the house, which has made a world of difference. We asked caregivers about any changes and modifications of employment based on reports from previous literature in ASMD. 2 reported that they did not have to change employment at all as part of their child's experience with olipudase alfa. 2 had to make other changes. There were 3 that had to decrease the number of hours due to treatment appointments. There was 1 that said they had to decrease hours due to medical appointments for symptoms of ASMD. 1 had to leave work or education entirely, and 1 was able to increase hours or days, but also had to decrease hours or days due to medical appointments for ASMD. So there's definitely impact felt across caregivers as part of participating in the clinical trial. I'm going to close with just asking or sharing comments about the level of satisfaction with olipudase. One comment, or the first comment, is that we've seen a drastic improvement in our child's physical, social, and mental health. He's able to engage and participate in age-appropriate play with his peers. He feels better about himself and his condition, knowing that it can be treated. Another comment, we see that this person is doing really well. There is not one symptom that we could wish to be further decreased. She has a lot of energy. Her belly is normal. She eats normal. She can play and do physical exercise like a normal 7-year-old girl. Also, the doctors tell us that they could not have wished for any better result, since all the parameters that are being measured or followed up have gone toward normal a lot. Another comment, I've seen almost complete resolution of the disease manifestations with the treatment. Another comment, our daughter leads a life just like any other 7-year-old without ASMD, and that's all you ever want for your child. We asked about perceived disease progression since starting olipudase alpha. 8 of the 10 said the condition improved. 1 said the condition stabilized, and 1 noted the condition progressed slower than without treatment. Remarkable. Close with a few more comments. The best way to describe it is that she's just like a typical child. Like when we share now that our child has an underlying metabolic genetic disease, people are totally shocked and surprised. I have to fill that information out when she attends like trampoline parks or attends school, and teachers and people are so confused because they look at her and they're like, wait a minute. It's a great problem to have. Another comment, it's a complete 360. Really, the healthiest person I think I probably know on earth right now is her. So she's completely changed. It was not only her health, but just her overall body figure that just completely was altered. She's a completely different person after receiving treatment. And we noticed, I would say within 3 months, that her figure was changing. She didn't have the distended stomach anymore. Another quote, honestly, it saved his life. And I would tell anyone that. A few more quotes. Everything has changed for our child. Physically, mentally, it's changed our family for the better. Another quote, it was life-saving for him. I mean, it really was. I think his organs were failing. I think he couldn't sustain his system much longer. Definitely was. Another quote, we're absolutely thrilled with the treatment. The demands of the trial have presented numerous challenges. However, the benefits of the treatment greatly outweigh them. My heart breaks for the parents whose children have ASMD and they're not in the trial and they're not receiving anything. And one particular family talks about how they've noticed their child doesn't do this anymore and that. It's heartbreaking because you honestly also feel guilty because your child is receiving this medicine and you have seen the benefits of it. And you know that they wake up every day and it's just devastating. It's devastating. And this medicine it saved my child's life. I believe this is the last quote. They're the best kids and they deserve every single opportunity that life can give them. I'm hoping and praying that this treatment gets FDA approved, and I'm hoping it can help so many other families in our position. Conan, do you want to take us through some of the analysis of the survey that we did?
Yeah, sure. And just, to speak to a little bit about, the strengths and weaknesses, I suppose, of the study design. And so this is a retrospective case series, and the methodology, was appropriate for the group of patients who we were keen to investigate here. And, it's particularly useful in rare disease with small numbers. It also helps extend the timeline over which we can examine impact and look at the outcome of interest. So we were able to look at the impact over a long time frame. The issues, of course, on the negative side are, researchers will be concerned that, these kinds of studies are prone to recall bias, particularly the before and after, and potentially prone to confounding. And I picked up on Simon Jones' comment there about the decreased level of infection and through the COVID period, and these analyses must be couched in that with those factors in mind. However, I think what we're aiming to do here is build on the existing evidence base, address some of the gaps that have existed from the trial that has been undertaken, and add much needed detailed insight from the patient perspective. And I think there's great value in hearing these patient perspectives. We noticed that in the qualitative work, that elucidation of some of the report, the survey data, helped us better understand the meaning behind the reports, the survey results, and really shed greater light on the underlying quantitative data. And I suppose that's the big benefit here of qualitative research. It really it really gives you a layer of detail and understanding that, you know, there's often missing in quantitative research. If we go to the next slide, please. Just sorry, I was going to just speak to the you know, where we're coming from in patient-reported data in the ASMD and the Niemann-Pick community more generally. We do lack validated quality of life measures, and more widely patient experience measures. And quality of life can be difficult to understand and to contextualize. But patient experience measures and issues like unmet need are really, really valuable. And you can see here, you know, just how important some of the messaging is, and some of the evidence that can come forward from a good quality validated survey on unmet need and patient experience. And we're lucky to have had some very good natural history work done by Melissa Wasserstein et al. We're lucky to have these high quality trials undertaken, and we're building on that in the INPDR by extending the data, patient reported data collection, and rolling this out very shortly to capture patient reported experience in terms of unmet need, cure quality of life, patient quality of life, and disease severity and symptoms, and looking over a longitudinal data set over time, so in the future we can address some of the gaps that exist in our understanding and build really high quality validated outcomes, so that we can much better describe and report the patient experience. But I think what we've done here is have made a really good progress in this, and we'll continue to work in this to help shine a light on behalf of the patient community and what patients and families are experiencing. I'll just let Justin take through the take-home points here.
Yeah, thanks, Conan. I apologize, that slide should have been in there, and I think that's the one that I had out of order earlier on in the talk. But just to second that, I think, you know, it's studies like these that underline the power of the patient voice, the experience, and really highlight the importance of the registry. And we're hopeful that all this work can become part of the registry, and work that we do coming off of this this study. I think will continue to spearhead the work that we're trying to capture, and the value in our own patient registry, in addition to the data that's already out there. So thank you for all the work you're doing in building a patient-owned registry that's global and inclusive, because it's going to be an incredibly powerful tool, just like I think this data set is. So I'll review take-home points. Before I do, I'll ask for your grace. I apologize. I had a thought that I would go over the hour, but we will be available to answer questions afterwards. So thank you for your time. What we learned is that ASMD is truly a systemic disease with a wide array of manifestations that impact quality of life. And we heard from the caregivers and patients about that. Olipudase alpha was associated with improvements in literally every non-neurologic manifestation that we asked about, and the emotional and mental health impacts of ASMD on both patients and families is significant, and that olipudase mitigated those impacts in a meaningful way. We heard that participation in a clinical trial impacted patients and families, but this burden was felt to be greatly outweighed by the perceived benefits of those involved. And despite the benefits of olipudase, there's an unmet need to treat the neurologic manifestations of the disease, and that the families involved feel all patients with ASMD need access to olipudase based on the life-changing experience that they perceived. I'd like to thank all the patients and families, and I think so would everyone who was involved in the study, who participate in clinical trials and participated in this study. We recognize the sacrifice that you make every day. And in those that aren't participating in trials, we appreciate all that you're doing to further our understanding of the disease by helping us and supporting your national patient organizations. And we appreciate you taking the time to bravely share your experience, those that did. These stories and the data, I think, will be very impactful and very helpful for all the reasons that Sandy highlighted at the beginning of the talk. And there's the two resources and the two studies that we looked at the beginning. And with that, I'm going to stop sharing my screen. And I think I will turn it over to you, Sandy.
Thanks, Justin. Thank you, Justin and Conan, for a great presentation. We do As Justin said, although we're running a little bit over time, we're more than happy to take questions. I do have one question in the Q&A that I'm going to give to you guys, but if the folks listening have more questions, please put them into the Q&A and we'll be happy to answer them. Justin and Conan, the question I have is as exciting outcomes are, I have lost faith that the FDA and insurance companies take this form of evidence seriously. How helpful is the hard data from this study?
Conan, I'll let you go first with that one, and then I can follow.
Yeah, this study adds a number of things. Firstly, we're looking at over a longer time period, and we're understanding the experience beyond that 12 months. So we're looking at treatment, and some of the patients have substantially longer time on treatment. So I think having the patient reported experience from that over that period is important. Secondly, capturing the patient, the patient voice here, both through qualitative and quantitative. I think you can see the messaging here is very strong. There's very consistent patterns in the data across a range of outcomes. That I think in itself is particularly valuable. Justin, if you have anything to add to that?
Well, I think, we've, in our experience in the NPC space, we have heard from regulators, including the FDA, on the importance of the patient voice and the patient experience. And we're working through that right now. And I think as patient organizations, this is the type of work we hope to bring to the table to help inform regulators, because they want to know our understanding of benefit, our understanding of intolerance of risk, and what we see. So I think, as Conan said, over 5 years, 3 years of experience for a lot of these patients, and looking at this data, while it's not a randomized controlled trial, what we're looking for is really, how impactful was this therapy? And I think for those that were involved, it can't be understated how impactful it is. So I remain very hopeful that this is exactly what regulators and other payers are looking for, to understand the impact that therapy has on a disease.
So I do have one other question that has come in, and I'm not sure if it's within your guys' ballpark or not. So we'll take a try. Hi, this is life-changing. Are there any side effects noticed soon after taking the drug? I'm not sure, Justin, if that was covered in Dr. Diaz's study or Dr. Wasserstein's.
I believe that they did report adverse events, and I see Simon Jones is on. And as far as adverse events, they are responsible for reporting everything a patient can experience. And so if I recall correctly, some patients experienced fever and nausea in the short term around the time of the infusion. But I don't have that data sitting right in front of me, so I'm hesitant to comment beyond that. And if Simon wants to type anything in, he can let me know. But those are the ones that I recall from the study.
Thanks, Justin. I have another question. Conan, I'm going to send this towards you as a starting point. What are the future research questions following the findings of this study?
Well, the next thing we're going to do is we're going to extend this study to the adult population and apply a similar approach, and we're hoping to start that quite soon. We're also we'll also be building on this in the international registry. We're really, as I said earlier, we really need to develop and strengthen our outcome measures, and we really need to collect longitudinal data here. There is other analysis from this data set that we can undertake as well, and we'll be looking at that too. And we'll be seeking to publish this within this year in a peer-reviewed paper in a peer-reviewed journal. Justin, anything you'd like to add?
No, we're hopeful to get this out as soon as possible, recognizing that that olipudase is being submitted and evaluated by regulators around the world, including its approval already in Japan. So we're we're trying to get this information out so it can be most useful to those who will find it so. And I think globally, we hope it'll have an impact. And just, hopefully this webinar can be shared, and we will soon be posting other information on it as quickly as we can, but going through the processes so it can be held legitimate and be considered to be part of packages for regulators and for payers and others that may find it useful.
Thank you, Justin and Conan. I do have two comments that have come up that are related, just in terms of the challenges that face us moving ahead, in terms of not all countries currently are able to access olipudase alpha through the managed access program for early access for individuals, because not every country is that an option at this point. As well as the challenges of, what do you do in the meantime while waiting for a drug to get to the point of approval? And what do you do if your country never gets to the point of covering a treatment that shows such potential benefit? Didn't know if either of you had any comments you wanted to. I absolutely recognize that these are big challenges and very personal ones.
I'll take a stab at that. So I appreciate that Sanofi has a managed access program in general. Not all companies do, and not everyone who has the opportunity to have one has one with every drug that they're using. But I think based on such stories like this, it's incredibly important to get as many patients access to this, and we're thankful that it's there. There are advocacy experts who work with Sanofi, and I don't think that every country has one, but I think there are global access specialists that can hopefully help with this. So I think one of the benefits of a national patient organization and an international patient organization is to at least connect you with resources and the right person who can identify what the next steps are. And for those that haven't already connected with someone, in this instance, if the managed access program is with Sanofi, with someone from Sanofi, that is a connection that we can try to make to an advocacy specialist to gain a better understanding of that. So if that connection has not been made, and if we can't, we'd love to help make that. My email is included on the NNPDF website, and you can reach out to me. And then I think one of the values of the national patient organizations is to advocate for each other. And I think we continue to work with Sanofi to advocate so every patient has access to this treatment. And I believe that Sanofi feels that exact same way and is working toward that. But we will continue to push. And so in those instances where access is an issue, I think hopefully information like this will be helpful. And hopefully we can, break through barriers, wherever they might exist, to try and get as many people access to this therapy as possible, and try and get it approved in as many places as possible.
Thank you, Justin. That was very well said. I'm just looking to see if there are any other questions. I don't see anything. Any last thoughts, Conan or Justin, you want to share?
I just said thank you very much to Justin for presenting the results so well, and thank you to all the patients and families who contributed to this, because we can't do this kind of work without you. So and it's really important to get this information out there. So thank you, everyone.
Yeah, thank you. And again, I thanked the patients that were involved, but also those that are contributing and are hopeful for treatment, like those that asked the question. We're all part of a community working together to make this happen and to get access to therapy. And we appreciate, I think, the INPDA, the INPDR, and all the national patient organizations, especially those that made this happen. And I think this is just the start of more great work to come in the Niemann-Pick space for both NPC and ASMD, and we're really seeing the value in our own data. So thanks, everyone. Appreciate your patience on the extra 17 minutes that we stole today. We hope to have this recording out, I think, in the coming days as well. So if there's anything you missed, it should be out there soon.
So yes, this has been recorded today, so it will be out for sharing. I do want to thank Justin and Conan for an absolutely brilliant presentation. Very delighted that we've been able to share this information with the broader community. I also want to extend my thanks to Justin, Conan, Tony, Jocelyn, and all of the team at NP and INPDR that have worked so diligently on this project and getting it up to speed and done in such a timely fashion with such excellent outcomes, and look forward to us being able to share the publication as we move ahead. If there are other questions that pop up into your heads later that you want to reach out to us, you can reach us at INPDA, INPDR, NPUK, or NNPDF. We're happy to help answer those questions. Thank you all for your time today. It's greatly appreciated.